Hi guys! So I said I'll start at 4, so I'll give everyone a few minutes. If you're watching a recording of this, you can go ahead and skip forward a few minutes. I typically wait just a few minutes till everybody gets here so that I can start when people arrive. Hello, hello. If you're just arriving here, go ahead and say hello. Hello, guys. I'll keep waiting a few minutes. Let everyone get here. Hi, Melissa and Marion, Ashley, and Laura. Good to see you too, Melissa. I love that you always get to attend. Do a little interactive poll while we're waiting for people to get here. It says, when is your testing month? So vote on when is your testing month up there. Hi, Cheryl. Good to see you. All right, we'll give it just a little bit more minutes. I know you're done, Melissa, and I'm proud of you. Yes, yes, yes. All right, well, let's go ahead and get started. With the money I've made from helping you guys learn and from you guys buying my videos and things, I was able to get a nicer computer so I can continue to do things like that. I bought the newest Leak edition so that we can have you know, some newer practice questions than there were in the old book. So again, I've been able to reinvest a lot of that that I've made, you know, by helping you guys back into this concept of helping y'all. So it's been a really good good experience. So let's get it started today. We'll do lightning questions, a lightning round of questions we'll do from the Leak book. So it won't be a topic like when I do the Fitzgerald ones. So we're just going to kind of go all over the place. So we'll work on how to pick the right answer. If you have questions, always just write them down there at the bottom, and I usually see them. They take a little bit, they delay a little bit by getting to me, but I'll see it and I'll like backtrack a little bit. All right. So I'll just read the questions. I give you the options, and then you can type down your letter, what you think the answer is, and then we will say what the answer is. Okay. The best form of aerobic exercise for a patient with severe rheumatoid arthritis is A, yoga, B, swimming, C, riding a bicycle, or D, passive range of motion. The best form of aerobic exercise for a patient with severe rheumatoid arthritis is A, yoga, B, swimming, C, riding a bicycle, or D, passive range of motion. Good, 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 good. Try again, Marion. Yep, good. Hi, Brooke. Hi, Hortense. Hi, Laura. Yes, good. Good job. Yep, the best exercise would be swimming. The best exercise would be swimming. Okay, that is what the American College of Rheumatology agrees is the most beneficial because it is a moderate intensity. So you can still get your heart rate up, you can still, exercise, and it's still got that, low impact feature. All right. Let's see. Which of the following effects are seen in every woman using Depo-Provera for more than 5 years? Depo-Provera for more than 5 years. A, melasma. B, amenorrhea. C, weight loss. D, headache. A, melasma. B, amenorrhea. C, weight loss. Or D, headaches. What do we see in a woman who's been using Depo-Provera for more than 5 years? That's the medroxyprogesterone injection for birth control. Good. Awesome, awesome, awesome. Good, good. Good. The answer to that one is B, amenorrhea. So the Depo-Provera usually causes cessation of periods. Within the first year, 55% of women actually have amenorrhea. By second year, 68% have amenorrhea. So it gets even higher around 5 years. It's most of your patients are going to be on that. All right, the following measures are used for prophylaxis or treatment of migraine headaches. Which is not considered effective for migraine? A, propranolol. B, resting in a quiet and darkened room. C, trimethoprim or Tigan. Or D, moderate sodium restriction. Which of those is not considered effective for migraine? A, propranolol. B, resting in a quiet, darkened room. C, trimethoprim, which is Tigan. Or D, moderate sodium restriction. All right, keep trying. Does anybody know what Tigan is? Everyone's guessing C. Does anyone know what Tigan is? Or trimethoprim? What is that medication? All right, that medication helps with nausea and vomiting related to migraine. So then it would be helpful. Yep, good, Cheryl Taj, you got it. It's an antiemetic. So not C. If it's not C, which one do you guys think it would be then? So we've eliminated C. What's propranolol? Do we know if propranolol helps or not? Think about that one. We know resting in a quiet, dark room is going to help with migraines because you've got the photophobia and the phonophobia. So then what's left? What's propranolol for, and then does salt have anything to do with it? Good. Yep, y'all got it now. Yep, Tanya, you're correct. It is for nausea and vomiting, and that's such a huge part of migraine disorder. Good job, everybody. We've now corrected our answer to be D, moderate sodium restriction. So sodium doesn't seem to play a large impact on migraine disorders, whether we have a lot or a little, so it's not really affecting it. Propranolol is definitely one of those prophylactic medications that they can use for migraine. Propranolol does a lot of things. It can help with, essential tremors. It can help with nervousness before going and giving a speech. Help post-MI. migraines. Propranolol, you'll see it being used for just a slew of things. All right. Any questions? Just keep, pop them over there, and I'll make sure I answer them. All right. A score of 2 on the mini-cog instrument is highly suggestive of delirium, B, dementia, C, mild cognitive impairment, or D, normal. A score of 2 on the mini-cog instrument is highly suggestive of what? Delirium, dementia, mild cognitive impairment, or normal. What is a 2? Good. If you've answered it, go ahead and try to think of what are the 2 parts of the mini-cog. What 2 things do we do in the mini-cog? Type those in if you can remember. Yep, good, Marion. Good, Laura. Good, Ashley and Melissa and Lisa. Good. All right, what 2 things make up the mini-cog? Yep, good, Marion. That's one of the 2 things is 3-item word recall. The second part of the mini-cog is the clock drawing test. The highest score you can get is a 5. 0 to 2 is suggestive of dementia. 3 to 5 is low likelihood of dementia. So again, that's just a brief assessment that we can do on patients to see if we think they have dementia. Yep, Cheryl and Tanya, y'all got it right. So 0 to 2, dementia. 3 to 5, low likelihood of dementia. And again, that's just a really short, it's just got the 3-word recall and the clock. Marion, I think counting set backwards from 100 by 7s is actually part of the mini mental, which is a lot more comprehensive examination. It's very long. So I think with the mini cog, it's just clock and the 3 words. It gets a lot briefer. A 35-year-old man has a history of an upper respiratory viral infection 4 weeks ago. He reports that he started feeling short of breath and now complains of sharp pain in the middle of his chest that seems to worsen when he lies down. The patient's physical exam is within normal limits, with the exception of a precordial rub on auscultation. So he's got a precordial rub on auscultation. The most likely diagnosis would be A, pulmonary embolism, B, dissecting aneurysm, C, pericarditis, or D, esophageal reflux. Okay, 35-year-old man, upper respiratory viral infection, short of breath, sharp pain in the middle of his chest, worse when he lies down. He has a precordial rub, and what is his diagnosis? Pulmonary embolism, dissecting aneurysm, pericarditis, or esophageal reflux. Good. Yes, Ashley. Good, Laura. Good, El Betty. Good, Dominique. Yep, good, Marianne. You got it, Hortense. Yep, Tanya, you got it. All right, yeah, you guys got it. It is pericarditis. And what kind of gave it away for us there was that definitely that rub. And it does, the pain with laying down is also indicative. That's worse when they're breathing in. It's not constant like with an MI. And then the question doesn't really talk about anything like after eating, which would be more indicative of the GERD. The pulmonary embolism, what doesn't really fit the scenario because he didn't have like a clotting risk or recent bone surgery or something like that, even though he was having difficulty breathing. This question is very similar to the style of questions I saw on boards. There's a lot of like, here's a bunch of information, here, try to pick out what you need. The way I like to approach these like case study type questions where it's got a lot of information about a patient. It's asking me to come to a diagnosis. I like to read the question first. So I read the question all the way through, all the information. And then when I get to the question, I'm like, okay, what is it actually asking me about, this big paragraph? Sometimes I don't even need the whole paragraph of information. So after I've read it once, I don't read my multiple choice question options yet, because they could distract me or try to like move me in a different direction than the answer that I should be getting. So I actually go back and I read the question a second time, knowing now what the actual question part is asking, so I can go back and reread all the information and say, okay, I need this part, I need this part. And then I sit and I think, okay, what would I answer to this question if there was no multiple choice options? Like, what would I come to the conclusion the answer is if I was just seeing a patient? Or if I read this in a textbook, what would I think it's describing? And then I try to get that in my head. And then I look at my multiple choice options, and you'll often find that what you were thinking or something similar to what you were thinking is actually in the options. It helps you from being distracted by other options, and that increases your confidence when you're actually answering your own question, because you may have actually guessed it before looking at the options. And that helps to pause and actually think about what you know, rather than looking at the 4 options and trying to figure out which one of those fits. Because you are smart, you know what the answer should be. And by thinking of it yourself rather than just like trying to find it, that actually can have better outcomes. So that's a recommendation I have, is read the whole scenario, read the question, read the scenario again, think about what you would answer, then look at the options. And that's a really good way to do it. Okay. Which type of exercise would you recommend to a 65-year-old arthritic patient who complains of a new onset of a painful, swollen left knee caused by overworking in the garden for 2 days? All right, which type of exercise would you recommend to a 65-year-old arthritic patient who complains of a new onset of a painful, swollen left knee caused by overworking in the garden for 2 days? Okay, so stop, think about what the question's asking, think about what you would recommend to that patient, not knowing what the answers would be. So pause and try to think of what you would tell the patient. What should they do for it? All right, now let's look at our options. A, quadriceps strengthening exercises of the left knee followed by the application of cold packs for 20 minutes 4 times a day. B, rest the joint and apply cold packs intermittently for the next 48 hours. C, passive range of motion in cold packs. Or D, a cool tub bath with warm packs on the knee to avoid stiffening of the joint. Okay. I'll read through the whole thing again. Which type of exercise would you recommend to a 65-year-old arthritic patient who complains of a new onset of a painful, swollen left knee caused by overworking in the garden for 2 days? A, quadriceps strengthening exercises of the left knee followed by the application of cold packs for 20 minutes 4 times a day. B, rest the joint and apply cold packs intermittently for the next 48 hours. C, passive range of motion and cold packs. Or D, a cool tub bath with warm packs on the knee to avoid stiffening of the joint. Good. Good, Marion. Good, Ashley. Good, Lisa. Good, Laura. Yep, you got it, Elle. Try again, Miranda. Good job, Cheryl. Good job, Tanya. Good job, Hortense. All right, good. So the answer to this one would be B, and it's part of the RICE concept. So we're doing rest and cold. We're doing rest and cold, which is part of RICE. So we've just injured a knee, we've overworked it, so we have a painful, swollen left knee. So what should we do immediately following an injury? We should do RICE. All right. Again, any questions that you have, anything you want me to explain further, type it down there and I'll get with it. All right. 427, that's number 427. Symptoms suggestive of ulcerative colitis include all of the following except. Symptoms suggestive of ulcerative colitis include all of the following except. Okay, so now what you're going to do is you're going to stop and you're going to think of what are symptoms of ulcerative colitis. So get that in your head. What are symptoms of ulcerative colitis? Okay, so now this is an accept question, so that means it's a negative stem, so we're looking for the thing that's actually not true. So now let's identify which of these are actually signs of ulcerative colitis, and then we can find the one that's not. A, bloody diarrhea mixed with mucus. B, nausea and vomiting. C, weight gain. D, abdominal pain. A, bloody diarrhea mixed with mucus. B, nausea and vomiting. C, weight gain. D, abdominal pain. Which of those are not suggestive of ulcerative colitis? Yep, good job, Cheryl. Try again, Hortense. Good job, Mary. Good job, Lisa. Yep. Good job. Laura, Tanya, Dominique, Miranda, and Ashley. Y'all all got it right. Yep, the answer to this one would be weight gain. You'll find often in the accept questions that, you know, 3 of them are obviously right. So we have the bloody diarrhea, nausea and vomiting, abdominal pain. You'll find the one that's wrong is usually opposite of what normally happens with the illness. So what normally happens with ulcerative colitis is weight loss. So often what you'll find is the accept or the negative stem answer is the opposite of something that normally happens. That seems to be a trend with these questions and how they're developed. All right, peak expiratory flow, or PEF meters, are used to monitor asthma by using personal best measurements. All the following factors are used to determine the PEF except. So this is another accept or negative stem question. So now you pause and you think, all right, what do I normally need to know about a patient to get my PEF? So you pause there. All right, so this is a negative stem. A, age, B, gender, C, height, or D, weight. Which one of those 4 do I not need to find my PEF? Age, gender, height, or weight. Good, good. Yep, good job. I like that, Malwell's HAG. Use HAG. I like it. Dominique, try again. HAG helps me remember. I like the HAG. I'll remember that. Good. All right, so then if it's HAG, like everyone's suggesting with this mnemonic here, it would be height, age, and gender are necessary, and weight is not. The reason weight doesn't matter is because that doesn't really help me determine my lung volume. Age, gender, and height, age and gender can help decide the build of the person, and then height lets me know how long their torso might be, so that's how long their lungs might be, which would be different. So I'm 5'3", and then my brother's 6'1", so that's important because his lungs are going to be a lot larger than mine. So his peak expiratory flow would need to be based off of a larger lung. But his weight wouldn't matter versus my weight. So that's why weight does not matter. Gender, because we are built differently. So a 5'3" woman would actually be a little more slimmer than a 5'3" man because they're built a little more stocky. So that would be why we need to know their gender, just because we are shaped a bit different. So it changes the shape and volume of our lungs. If that helps out, Elizabeth there. All right. Next question. We'll do a bug question. Fun. A red raised serpiginous. Someone tell me how to say that. I've always wondered. It's the serpiginous. Serpiginous. I'm going to type that in. So if someone can give me like a good way to say that, because I'd love to know. I want to sound educated. A red raised serpiginous shaped rash is noted by the nurse practitioner on the right foot of a 4-year-old child brought in for a preschool physical by the mother. The child complains of a severe itch and keeps scratching the lesion. The mother reports that the child frequently plays in the yard without wearing shoes or sandals. Which of the following is most likely? A. Larva migrans, B. Erythema migrans, C. Tinea pedis, or D. Insect bites. A. Larva migrans, B. Erythema migrans, C. Tinea pedis, or D. Insect bites. So we've got a red, raised, serpiginous shaped rash. It is itchy, and they're scratching it, and they play outside without shoes on. Which one do they have? Good job. AKA creepy eruption. I like it. Good. Awesome. Everybody got that one right. It is the larva migrans. Wonderful. All right, next. All of the following are considered risk factors for UTIs in women except, so another negative stem. A, diabetes mellitus, B, diaphragms and spermicide use, C, pregnancy, and D, intrauterine device. All are risk factors for UTI except diabetes mellitus, diaphragms and spermicide, pregnancy, intrauterine device. So which one's not associated with UTIs? Good. Good, Ashley. You got it. Yep. Good job, Cheryl and Laura and Lisa. Good job. Yep. You guys got it. Good. The answer to that one is D, the intrauterine device. So pregnancy definitely messes with pH, so that changes everything down there, makes you more susceptible to UTIs, as well as diabetes mellitus, especially if they are not as well controlled, if they're still urinating out some sugar or they're on one of the medications that make them urinate out their sugar. They're at risk for UTIs just because it's both caustic, irritating, changes the pH. The diaphragms and spermicide use, that also can alter pH and can be a result of poor hygiene, making sure that patients understand they need to, rinse and wash their diaphragms, etc. So those are all associated with UTIs, whereas an IUD, it's sterile, it's just inside the uterus, it doesn't mess with the pH or anything like that, so it's safe. All right. You are performing a pelvic exam on a 25-year-old sexually active woman. You palpate a tender and warm cystic mass on the lower edge of the left labia majora, which is red. The most likely diagnosis is A, a Skene's gland cyst, a B, cystocele, C, lymphogranuloma venereum, or D, Bartholin's gland abscess. So you're doing a pelvic on a 25-year-old sexually active woman. You find a tender, warm, cystic mass on the left lower edge of the left labia majora. It is red. What does she most likely have? What's the diagnosis? A, Skene's gland cyst, B, cystocele, C, lymphogranuloma venereum, or D, Bartholin's gland abscess. Yep, everyone who's answered so far got it right. Awesome. Awesome, awesome, awesome. So what's a cystocele? Let's talk about the other ones so we can learn something if we don't know what those are. What is a cystocele? Write in what a cystocele is. Just type it in. So we can talk about all three of the others as well. All right, a cystocele, if I don't see any answers, so maybe we don't know. Cystocele is usually like bladder prolapse, okay? So it would be, you know, right inside of the vagina, it would be red and smooth, and you could palpate it. It just means that the bladder has prolapsed back into the vagina. Typically that patient is, yeah, good job, Laura. Yeah, typically that patient's older and has had kids. That they're definitely more at risk. Yeah, good job, guys. All right, then what is a Skene's gland cyst? What is a Skene's gland cyst? Okay, so a Skene's gland cyst is when that duct gets obstructed. It's just adjacent to the distal urethra, whereas the Bartholin cysts are lower. So you've got Skene's is up here, whereas your Bartholins will be lower. Okay. Bartholins are much more common, and they're common in sexually active women, so that's another good tip there. All right. A patient diagnosed with bacterial vaginosis should be advised that her sexual partner, A, needs treatment with ceftriaxone 250 milligrams IM with doxycycline 100 milligrams BID for 14 days. B, needs treatment with metronidazole or Flagyl 500 milligrams PO BID and 1 dose of azithromycin. C, does not need treatment, or D, needs treatment with Lotrimin on his penis BID for 1 to 2 weeks. So female has BV. Should we treat the partner with Rocephin and Doxy for 14 days, Flagyl and azithromycin, no treatment, or Lotrimin on the penis? Good. Good, 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 good. Yep, you guys got it. Yep. Good job. Yep, so we don't need to treat this in the male. Men don't typically have the same infection in some manner in themselves. There's not like a male version of bacterial vaginosis, so there is no treatment needed for the male partner. All right. Which of the following statements regarding physiological changes found in the elderly is incorrect? Which of the following statements regarding physiological changes found in the elderly is incorrect? Okay, another negative stem question. A, there is an increase in the fat to lean body ratio. B, there is a decrease in the ability of the liver to metabolize drugs. C, there is an increase in renal function. D, there is a loss of hearing for sounds in the high frequency range. A, so again, we're looking for the one that's not one of the normal changes. Okay, so A, there is an increase in the fat to lean body ratio. Think in your mind, is that true or false? B, there is a decrease in the ability of the liver to metabolize drugs. C, there is an increase in renal function. Or D, there is a loss of hearing for sounds in the high frequency range. Yep. Good job. Good job, you guys. You got it. Yep, so the change there would be that there's not an increase in renal function. Like I said earlier, most of the negative stem ones, you'll find that the answer is opposite of something that should happen. Okay, so in this one, normally there's a decrease in renal function. Here it is, there's an increase in renal function. And that's really how they're trying to make sure you're paying attention to the question. So again, the answer that you choose in a negative stem question is often opposite of something that would normally happen within the disease process. Okay? All right. All of the following clinical signs are seen in patients with Parkinson's disease except, so another negative stem, and there were so many on my board, so you really have to pay attention to what it's saying. I would, mentally circle it if I needed to, and just be like, okay, except, I'm in another negative stem question. So we're talking about Parkinson's signs. So all of these are signs except A, pill rolling tremor, difficulty initiating involuntary movement, C, shuffling gait with cogwheel rigidity, D, increased facial movement due to tics. A, pill rolling tremor, B, difficulty initiating involuntary movement, C, shuffling gait with cogwheel rigidity, or D, increased facial movements due to tics. And remember what I've said, most of the time the answer is opposite of something that you should see. So find the one that is wrong and is opposite of something that should normally occur. Good job, Cheryl, Laura, and Lisa. Good job, Marion. Good job, Miranda. Yep, good job, guys. Yep, so increased facial movement due to tics would not be normally seen. What's normally seen? They have a really tight, unexpressive face, right? Think Michael J. Fox. It's kind of plastic looking almost, and very, very doesn't emote anything. So like I said, when it's a negative stem, it's often opposite. All right. Which of the following conditions is a possible complication of severe preeclampsia? All right, so think about severe preeclampsia. Stop, get what your answer might be in your mind, and then we'll read those. So what is a possible complication of severe preeclampsia or severe eclampsia? What can happen? Think of the things that happens with severe eclampsia. Then we'll pick the right one. All right, A, placenta previa, B, placenta abrupto, C, erythroblastosis fetalis, or D, uterine rupture. Which of those is a possible complication of severe eclampsia? Placenta previa, placenta abrupto, erythroblastis fetalis, or D, uterine rupture. Good. Good, Cheryl. Yep, good job, Marion. Good, Laura. Good, Miranda. Yep, you guys have got it. So what can happen here is placenta abruptio. Because of the hypertension, it's pounding so hard that it could cause the placenta to pull away from the uterine wall, which of course can cause both death of the baby as well as bleeding out potentially of the mother. So that is definitely an emergency. Okay. And they'll typically complain of pain as well as bleeding. A possible complication of Bell's palsy is, okay, so stop, think of what Bell's palsy is, because you know this, and then think of what's something that can happen with Bell's palsy. Okay, and then our options are A, corneal ulceration, B, acute glaucoma, C, inability to swallow, D, loss of sensation in the affected side. So A, corneal ulceration, B, acute glaucoma, C, inability to swallow, or D, loss of sensation in the affected side. Good job, Cheryl, Laura, and Dominique. You guys got it. Try again, Tammy. Try again, Zora. Good, Marion. Good, Miranda. All right. So the answer to that one would be the corneal ulceration. Bell's palsy is not the nerve that helps with swallowing. That would be 10, 11, and 12 kind of all work together to make you swallow. They all do different things. But Bell's palsy does not affect 10, 11, or 12, so they should be able to retain their ability to swallow. What actually does happen, however, is they get that droopy eyelid, and that, they lost the wrinkles and everything. So a lot of times they aren't able to shut their eye. What happens there is they end up with a lot of dryness, and that actually can lead to an ulceration. So that's why they end up getting the corneal ulceration. So one of the treatments that we actually will do for Bell's palsy is to tape the eye shut until the episode has resolved. All right. All right, which of the following is most likely to cause delirium? All right, so think about what you know about delirium. What are the common causes of delirium? As RNs, we've seen a lot of this on the floor. All right, is it dehydration, multiple brain infarcts, C, malnutrition, or D, acute infection? What of those is most likely to cause delirium? A, dehydration, B, multiple brain infarcts, C, malnutrition, or D, acute infection? Most likely to cause delirium. What is delirium? Try again, Cheryl. Good job, Tammy. Good job, Laura. Good job, Ginger. Try again, Cheryl. You get it. Good job, Tanya. Good job, Marion. Good. All right, so the answer to this one would be acute infection. So think of UTI, think of pneumonia. Some of the most common things that can occur with that is the acute infection is the delirium. So other causes are, fever and shock and dehydration and things like that. But the one that's most likely to do it, however, is the acute infection. Okay, our next one, again, this one reminds me a lot of the questions I saw on boards. If it starts off with the description of a patient, you're getting a board-like question. A 25-year-old woman presents with severe right-sided pelvic pain that began 48 hours ago. She reports small amounts of vaginal bleeding. The pain is aggravated by jumping or any movement that jars her pelvis. The best initial intervention is which of the following? A, follicle stimulating hormone test. B, HCG test or urine test for a pregnancy test. C, pelvic ultrasound. Or D, CBC with white cell differentials. So A, FSH test. B, HCG test. C, pelvic ultrasound. Or D, CBC with white cell diff. Yep. Yep. Laura, Miranda, yep. Cheryl, yep. Lisa, Zora, yep. Good job, Tanya and Marion, good. Good. All right, so what do we think her diagnosis is? If we're thinking HCG is the best thing to order for her, what are you guys thinking her diagnosis is? Type in her diagnosis. What is her diagnosis? Good job. Yep. Good job, good job. Yeah, especially with the pain, the bleeding, and that jumping. So that's why a lot of times when people come in with just kind of this generalized abdominal pain, and we don't really know what it is, and they're childbearing age, we got to rule out, gallbladder, ectopic, like a lot of the things that can happen in younger women. So the best thing to do is just get the urine pregnancy, get the HCG. All right. Our next question. Which of the following laboratory values may be elevated on the liver function panel of patients who are alcohol abusers? So which of the following lab values may be elevated on the liver function panel of a patient who abuses alcohol? A, serum GGT, B, serum creatinine, C, serum bilirubin, or D, blood urea nitrogen? Which of those may be elevated? Good job, Cheryl. Yep. Good job, Brooke. You got it. Good job, Laura and Marion. Good job. Good job, Tanya. Yeah, you might not know this one. This isn't something that, a lot of people know. So if you don't know about this one, then great, we can learn something today. The answer to this one would be A, serum GGT, which is the gamma glutamyl transaminase. Okay, so it can be elevated in people who abuse alcohol, and also those who have liver disease and bile duct obstruction. But it will be definitely elevated in those with alcohol abuse. The kidneys are not exactly as affected by alcohol. Okay. All right, the next one is another case study question. So we're actually going to have several questions on this case study. All right, a 10-year-old boy complains of sudden onset of scrotal pain upon awakening that morning. He is also complaining of severe nausea and vomiting. During the physical examination, the nurse practitioner finds a tender, warm, and swollen left scrotum. The cremasteric reflex is negative, and the urine dipstick is negative for leukocytes, nitrites, and blood. All right, so go ahead and pause in your mind. What do you think is going on with this patient? What would you do for this patient to start kind of getting those wheels turning? And then we can probably find that what we're thinking about is probably where the questions are going to lead us. Okay, so the most likely diagnosis is what? What's the diagnosis? Exactly. And the next question after that is what kind of follow-up should this patient receive? So what's his diagnosis and what should we do for it? Which is exactly what, before I even looked and read those questions, I assumed it was going to ask me about. Yep, good job. Good job, guys. Y'all got it. Good job. Yep, Cheryl, you got it. You got it. Yep, our most likely diagnosis for this is testicular torsion, and our follow-up would be to refer him to the emergency department as soon as possible. Good job. The testicular torsion, most common times you'll find it occurring is upon waking and upon like either trauma or activity. That's a lot of times when the initial pain will start. I just covered all of this in the pediatrics video I put out about a week and a half ago. and the negative cremasteric reflex, which means you touch the inside of the thigh going upwards towards the groin, and you do not see the scrotum kind of retract. She feels that that tender, warm, swollen left scrotum because it's going to be swollen and painful for the patient. So there's a lot of really good tips here. They're also often associated with nausea and vomiting, so he's also got that. If you ask the patient, about 50% of them will look back in their past and say, yeah, I've been having kind of like just little bits of pain here and there, but nothing that stayed like this before. It's because that testicle has been slowly kind of turning. It takes 720 degrees of torsion before it actually cuts off. So they could be having some occasional pain before it got completely twisted and cut them off. Okay. All right. You note that your 11-year-old female patient is at Tanner stage 2. You would advise her mother that menarche will probably start in A, 2 to 3 years, B, 3 to 4 years, C, 5 years, or D, it is dependent on the girl's genetic makeup. So we're 11 years old, Tanner stage 2, when will we start menarche? 2 to 3 years, 3 to 4 years, 5 years, or dependent on the girl's genetic makeup. Good job, guys. Tanner stage 2. Tanner stage 2 is, I always say, remember it as we've got 2 boobs. So that's thalarch. That is the beginning of breast bud development. And once breast bud development has happened, it's usually within 2 years, but can be within the first 2 to 3 years after that, they'll actually start menarche. So we would expect her to be anywhere from 13 to 14 when she had her first menstrual cycle. There is a higher risk of balanitis in which of the following conditions? Balanitis in which of the following conditions? A, renal insufficiency, B, diabetes mellitus, C, Graves' disease, or D, asthma. Higher risk of balanitis with renal insufficiency, diabetes mellitus, Graves' disease, or asthma. So stop and think of what is balanitis. Okay, and then who would we see that in? Good job, Cheryl and Laura and Brooke. Good job. Good job, Miranda. Good job, Marion. Good job, guys. Yep, so we would see it more often in patients with diabetes mellitus. Balanitis is a yeast infection of the glands of the penis. It is more common in those with diabetes or also in those who are uncircumcised. So that's the 2 populations where you might see balanitis associated with. All right. A split S2 heart sound is best heard at which of the following areas? The aortic area, the pulmonic area, the tricuspid area, and the mitral area. Split S2 is best heard at which of the following areas? The aortic area, the pulmonic area, the tricuspid area, or the mitral area. Where would we hear this? Good job. Yep. You guys got it. Good job. Yep. Yep, the answer to this one is B, pulmonic. So the S2, when we talk about the split S2, that's that normal physiological split. It's just because the aortic and pulmonic kind of close like just a little bit further apart. So that's why we can have that little split there. So you can hear it in a lot of people if you're listening well and they're slimmer and they're got good loud heart sounds. You might be able to hear that. So again, it's in the pulmonic area. So the answer would be B, pulmonic area. All right. The sentinel nodes, also known as Virchow's nodes, are found at the A, right axillary area, B, left supraclavicular area, C, posterior cervical chain, or D, submandibular chain. The sentinel nodes, Virchow's nodes, are found at the A, right axillary area, B, left supraclavicular area, C, posterior cervical chain, or D, submandibular chain. All right, I got a couple answers to that one. They were correct. The answer to that one is B, the left supraclavicular area. So the sentinel nodes, why we actually know about these and need to know about these is because it's where a lot of our cancers will drain to. So if those are inflamed, that can often be a warning sign that there's cancer going on somewhere in the body, and they might need to be biopsied to see, you know, where the cancer has come from originally. Because typically that is a sign of metastasis if we have those lymph nodes specifically being swollen. So that's why we need to know what they are. Again, those are the sentinel nodes, also known as Virchow's nodes, and they're in the left supraclavicular area. All right, and that will conclude our review for today. Just a few notes. I will be doing, I believe I'm going to do cardiology next for our next video that I'll put out that you guys can purchase and download and watch whenever you want to. As far as studying goes, I hope you guys are doing well and pacing yourselves well. When I was in grad school, they recommended a certain number of questions for different populations, and I really agree with what they said. If you are an A student, you need to do about 3,000 practice questions before you take boards. And if you are a B/C student, you need to be closer to like 6,000 practice questions. So this book right here has about 650. If you do a couple of predictor exams like APA and PSI, that can be another 300, 450 if you do like 3 of those. Fitzgerald has a bunch of questions in it, and then there's apps out there like F&P Mastery and then Pocket Prep. So I mean, I really recommend that the more questions you do, the better and better you're going to get. And it's going to help you identify areas where you're not doing so well. So if you can find an area that, hey, I'm not so good at geriatrics, or maybe I'm not so good at women's health, or, those kind of things, you can try to identify what you need help with, and then you can maybe work with a one-on-one tutor, or, read in the Fitzgerald book about that specific section, or the Leak book about that specific thing. So again, my 2 favorites obviously are always been Fitzgerald and Leak. Again, with the money that's coming in from me doing the live videos and everything, I want to buy some more of the other people's reviews so I can kind of judge them for myself, kind of review all of them, and then make my best recommendation for a study plan for students. So stay tuned for that. All right. By the end of the next week or 2, I'll be launching my website. So you'll now be able to download my videos immediately at purchase, and they'll be in like a downloaded file instead of a Google share document, so you'll actually have better access to them in the future. Again, I was able to purchase a website with some of the money that you guys have been purchasing my videos with. So again, know that a lot of that money is being reinvested back into this project here, this thing that I'm doing, so we can keep growing as students and as nurse practitioners. Okay. If you're watching the recording, I am glad you're watching it. I may not answer back, but if you have questions too and you're watching the recording, please, message me a question or leave it on here. I do try to go through and read posts that are done later and try to answer questions if you have them. All right. Well, it was fun hanging out with you guys today, and I'll see you next time. Bye.